Hi everybody, my name is James Price. I'm a clinical academic in infection. I've worked with the NIHR Integrated Academic Training Programme for a long time now in Kent, Surrey and Sussex. I started a good few years ago as an academic foundation doctor in Brighton, where I first got my experience, or first started my experience with infectious diseases and microbiology. I progressed to undertake an academic clinical fellow role, again in Kent, Surrey and Sussex. And from that gave me a stepping stone to do a PhD in collaboration with the University of Oxford. And then after completing that, I came back as a clinical lecturer and did some postgraduate work, again based in Brighton. After that, I came to the end and hit CCT and moved to London for a period of time during the COVID pandemic, where I worked as Director of Infection Prevention and Control at Imperial College Hospital. And then back in 2022, I came back to Brighton as an Associate Professor in Infection. So that's what I continue to do today. I work 50% of my time as a consultant in infection and an infection control doctor, and 50% of my time undertaking research. And my particular area of research is around application of new technologies like genomics and prediction tools to reduce healthcare infections and support sustainability. And one of the key roles I do there is I lead the Infection Integrated Academic Training Programme at KSS. So I've had some personal experience with the scheme and working around the area as well. So the Department of Global Health and Infection spans a large portfolio of work across infection specialties and across global health, and we have great experience with some academic and clinical academic colleagues. From an infection point of view, I'm pleased to announce that we've newly developed a Centre of Infection, which I co-direct with my colleagues Simon Waddell and Lena Al-Hassan. And this centre is about bringing together the infection research that we do to support bench-to-bedside infection research, to strengthen our preventions of infection and management of infections in hospital and non-hospital healthcare settings. And we've got cross-cutting themes around sustainability, around health economics and public and patient engagement and involvement. Some of the specific work that we do are data-driven and molecular approaches in infection sciences. So as I mentioned, we've got a strong background on whole genome sequencing. We've got a developing department of metagenomics and AI-driven predictive analysis, which we're using to optimize how we prevent infections, use antibiotics more effectively, and determine outbreaks. We do a significant work in clinical trials and therapeutics research, and we're embedded within the University Hospital Sussex's NIHR Commercial Research Delivery Centre. And we're developing new trial methodologies and working with NIHR portfolios. Interestingly, one of our current trials is around personalised antibiotic duration for cellulitis, of which one of our integrated academic trainees has been designing and developing, which is great. And another area we're really gaining traction on is sustainability around infection prevention and healthcare, and we're working with the newly established National Transdisciplinary Hub for Healthcare Decarbonisation and ways that we can challenge infection control strategies and how they impact healthcare. And then from a global health point of view, we have a very active and successful global health research department. As an NIHR Global Health Centre of Excellence, our work spans neglected tropical diseases, antimicrobial resistance in low-middle income settings, TB, HIV policy, and women's health inequalities. So there's a whole range of expertise that trainees can come engage with. And we have some really strong collaborations with other departments across both the university, within Brighton and Sussex Medical School, within the other universities locally, and across other clinical specialties within the hospital as well. So the Infection Integrated Training Programme at Kent, Surrey and Sussex has a really strong track record for success in our fill rates and our retention rates, the fellowships people have gone on to get, and the progression through careers. So to give you some examples, we've had a significant number of our integrated academic trainees who secured nationally competitive fellowships with NIHR, MRC, Wellcome, International Society of Infectious Diseases. And those have gone on to show some major major funding awards that a number of our early career researchers have obtained through Bill and Melinda Gates Foundation, again, MRC Wellcome, NIHR, Fleming Fund, and a number of commercial and industry partnerships. And we've seen these all contribute toward high impact. And we've got an internationally recognized platform of research. Our top cited trainee has got nearly 6,000 citations with an H index of 30. So really showing the power of what the training program can do. And these have also been recognized through prestigious research awards, which a number of our trainees have been successfully achieved. So the British Infection Association Barnett Christie Award, 2 of our trainees have been awarded this. We have one of our trainees who was awarded the European Society of Clinical Microbiology and Infectious Diseases Young Investigator Award. We have a winner of the Royal College of Pathologists Research Medal, the Healthcare Infection Society Early Career Award, and the British Infection Society Clinical Exchange Award. A really strong track record, and this is reflected in the career progression as well. We've got a significant number of our ACFs have completed both their ACF and a PhD fellowship, and we've got at least 4 ACFs who are currently developing competitive PhD applications. In terms of our clinical lecturers, we've seen progression to academic roles. Myself progressed to an associate professor here, and I'm leading a research team. We have one of our CLs that's been appointed to a lead of a national research program at UKHSA and overseeing a large research portfolio. And the clinical lecturers we have at the moment are well on their way to their trajectory towards senior academic roles. BSMS and University Hospital Sussex and the region are really important for clinical academic training, particularly in infection. And we've got both outstanding academic and clinical training environments. To give you an idea of those, at University Hospital Sussex, this is an NHS England Regional Infectious Diseases Centre for Kent, Surrey and Sussex. So this provides our trainees with exposure to complex infection cases, specialist inpatient care and consultation services. We're now a member of the NIHR Commercial Research Delivery Centre. So this enables trainees to engage with clinical trials, policy relevant research and industry partnerships. And at BSMS, at the Brighton Sussex Medical School, we host both the Centre of Infection and the Centre of Excellence in Global Health Research. So providing a fantastic infrastructure for early career researchers to develop alongside appropriate support and expertise. And we have such a really wide variety of academic supervisors and mentors with expertise across infection, antimicrobial resistance, and global health. And these give our trainees a really fantastic opportunity, both locally, for local, national and international collaborations. I've been very fortunate and privileged to have been able to work my way through the integrated academic training program in KSS. I've had a great experience. I think things that I would maybe suggest to people when they're applying to these types of programs are choose an area that interests you. It's really important that you value what's going on and you're interested in it. But I'd also say try not to be too fixed. There's lots of areas to explore with that. So keep an open mind, have a chat with people about what research they're doing and how it might align to your areas of interest. I'd say think about choosing a supervisor that's supportive and who resonates with you. I think the best fellowships come out of a good working relationship with supervisors that can be there to support you when you need you, but also allow you to develop your own independence. I think the other thing is, like when you're training clinically, academic training is that in itself, it's training and it's a process. I think there are some misconceptions that people need to be a complete academic package at the start. But for me, it's about people who are engaged, proactive, interest, and show what they've used in previous opportunities. And that's what we look for. And I suppose working as part of the integrated academic training program at Kent, Surrey and Sussex, well, it doesn't harm to be working near the sea and a vibrant place like that as well. So yeah, a couple of my thoughts.